report really shows the ongoing magnitude and severity of the strain, the pressure that nurses and healthcare workers are under right the way around the world. And frankly, we're seeing too many governments either having failed or being very slow to act to prioritise their safety. This issue of recognising coronavirus as an occupational disease is really important, because when you recognise it, you collect data, you do more risk assessments, you set standards, and you also ensure there's compensation for people who become unwell. We know that coronavirus can last for a long time. It may be a prolonged period of sick leave, or for people who die. By not recognising COVID-19 as an occupational disease, it's symptomatic of too many governments looking the other way. So we're asking them to do that, along with all of these other measures to ensure that people can feel safe and protected when they go to work. The applause has stopped, but nurses are still in the eye of this pandemic. We are delighted that WHO on, as you say, World Patient Safety Day are saying the focus needs to be on health workforce safety. And they're not an either or. It's two sides of the same coin. Where nurses and healthcare workers work, it's the same place that we receive care and treatment. If the environment of care is not safe for health workers, if there are too few staff, if they don't have the right equipment, that means there are risks to the safety of patients. So the fact that WHO are recognising internationally, shining that global spotlight on the indivisible relationship between health worker safety and patient safety is a good thing. There's a charter that's published today, and what we're saying is, look, right here, right now, something that governments everywhere can do is to sign up to that charter, to commit to that charter for the sake of their workers, their nurses, but also their people, patients.
But is signing up to the charter enough?
No, it's not. No, it's not. I think, an international charter is very powerful, but it needs action. We need to see governments to commit to that charter, but then we need to see them to act on it. Recognise COVID as an occupational disease. Ensure testing. Testing's a problem, often only for symptomatic healthcare workers. PPE is a problem, particularly still in care homes and long-term facilities. There's not been enough training on infection prevention and control as well. And we have a huge hidden burden of mental health pressures. Provide more mental health support. These are practical things that we want governments to act on. And I don't think if they sign the charter and they don't act, they haven't done their job.